Last year, Interpede USA generated $90 million in revenue, operating 60 locations across 17 states. This year, they filed for bankruptcy with zero revenue. Let that sink in. Now, how does a $90 million company disappear in 3 days? The answer reveals a hidden crisis that's destroying home health agencies across America. But here's the part that'll shock you. Most agencies aren't actually failing. They're being systematically eliminated by 3 invisible forces that no one talks about. Today, I'll show you why the failure statistics everyone quotes are completely wrong, reveal 3 silent killers that are forcing closures nationwide, and expose the disturbing truth about what's really happening to independent home health agencies. But first, let me tell you about the phone call that changed everything for Lisa Martinez. It was 3:47 p.m. on a Tuesday when Lisa's phone rang. The caller ID showed the number she'd been dreading for months. Her biggest referral source. Lisa, we're sorry, but we're moving all our referrals to Centerwell Home Health. They can guarantee 24-hour response times and never turn down patients. Lisa had built her Phoenix agency over the course of 5 years. Excellent nurses, satisfied families, growing revenue. But in that moment, she realized she was fighting a war she couldn't win. I thought I was competing against other small agencies, Lisa told me months later. I didn't realize I was actually being hunted by billion-dollar corporations with unlimited resources. Lisa's story illustrates the first invisible force destroying agencies, the consolidation trap. Here's what most agency owners don't understand. You're not competing in a fair market. You're a fish swimming in a tank while sharks circle, waiting for you to show weakness. Chain-owned agencies have doubled their market share from 11% to 17% in just over a decade. But that statistics hides the real strategy. Companies like Humana, Centerwell, Optum, and Amedisys aren't just growing. They're systematically starving independent agencies of referrals, then acquiring their patient lists at fire sale prices. The process is methodical and brutal. Large chains offer hospitals integrated services, guaranteed staffing, and 24/7 availability that small agencies can't match. Hospital discharge planners who control the referral pipeline naturally prefer providers who never say no to patients. Independent agencies watch their referral volumes decline month by month. Revenue drops, but fixed costs remain. Staff gets stretched thinner. Quality suffers. Eventually, the agency owner gets a call offering to buy their patient census for 30 cents on the dollar. Lisa held out for 18 months, watching her census shrink from 250 patients to 180, then to 120. When Centerwell offered to acquire her agency, she had 2 choices: sell or close. They didn't destroy my agency, Lisa realized. They starved it, slowly, until I had to surrender. But consolidation is just the setup for real killers. The second invisible force is what I call staffing death spiral. Picture this. You run a 100-employee home health agency. Last year, 79 of your employees quit. You spent $423,000 just replacing them. Most quit within 100 days before you recover your training investment. This isn't a hypothetical scenario. This is the reality facing home health agencies right now. The industry averaged 79.2% turnover in 2024, the highest in 5 years. Marcus Thompson lived this nightmare in Atlanta. His agency grew to 50 employees by 2019 with a manageable 35% turnover rate. Then something changed. By 2024, his turnover hit 85%. Every Monday, I walked into the office wondering who had quit over the weekend. Marcus explained, We became a training academy for other agencies. The numbers behind this crisis are staggering. Replacing a single registered nurse costs $56,300 and takes 87 days. Direct care workers quit at a 64% rate in their first year. Only 16% of nursing applicants get hired, down 25% from previous year. But here's the twist that makes this crisis unsolvable. You're not just competing against other healthcare employees anymore. Target pays $15 to $20 per hour with predictable schedules and no emotional trauma. Starbucks offers benefits, stock options, and even college tuition. Amazon warehouses provide overtime opportunities without heartbreak of watching elderly patients decline. Home health agencies are asking workers to handle the most emotionally demanding healthcare work for wages they can earn scanning barcodes at Walmart. Marcus watched his best nurses leave for hospital positions offering $10 more per hour. His staff integrated to retail jobs with better work-life balance. New graduates chose anything except home health. We went from selective hiring to begging anyone with a pulse to apply, Marcus said. Quality became a luxury we couldn't afford. The staffing death spiral accelerates because desperate agencies make desperate decisions. They lower standards, hire underqualified workers, and cut training. Patient satisfaction drops, complaints increase, referral sources lose confidence, census declines, revenue falls, the agency cuts wages and benefits. More staff quit. Marcus closed his agency last year, not because he was incompetent, but because the math stopped working. Now, let me show you the third invisible force, the one that can destroy agencies overnight without warning. This one's different because you don't get months to fix it. Regulatory violations can shut down your Medicare certification in 23 days. And once that happens, your agency is dead. Jennifer Walsh discovered this the hard way. Her Vermont agency had operated successfully for 12 years. Clean surveys, satisfied patients, steady growth. Then came the surprise inspection in March 2024. The surveyors found what they had classified as level 1 standard violations: missing signatures on care plans, OSS documentation errors, inadequate physician order protocols. Jennifer thought these were minor paperwork issues that could be corrected quickly. She was catastrophically wrong. Level 1 violations automatically trigger extended survey covering all 15 conditions of participation. The agency had 90 days to correct deficiencies or lose Medicare certification. When follow-up inspections found continued problems, CMS terminated its agreement. Jennifer's 12-year agency closed within 6 months. I spent more time with lawyers than patients in my final year, Jennifer told me. The legal fees alone cost more than my annual profit. The regulatory environment has zero tolerance for mistakes. Documentation errors that might result in claim denials elsewhere can trigger fraud investigations in home health. The 2025 National Healthcare Fraud Takedown charged 324 defendants with over $14.6 billion in alleged fraud. Recent cases show how quickly investigations escalate. OpNet Healthcare Services owner received 75 months in federal prison for falsifying medical records. Even unintentional billing errors can trigger investigations costing hundreds of thousands in legal fees. But there's the disturbing pattern connecting all three forces. The agencies getting eliminated aren't failing randomly. They're being systematically removed by design. Large healthcare corporations have figured out that it's cheaper to let small agencies struggle with these forces than acquire their patients and staff at bargain prices. Chain agencies have compliance departments, staffing pipelines, and referral networks that independent agencies can't match. When regulations tighten, they adapt. When staffing gets expensive, they absorb the cost. When hospitals demand 24/7 availability, they provide it. Independent agencies face the same challenges without the resources to solve them. They can't hire compliance officers for $150,000 annually. They can't offer sign-on bonuses of $20,000 per nurse. They can't guarantee hospitals unlimited capacity. The result is predictable consolidation disguised as market forces. The 2020 statistics showing only 2 bankruptcy filings hide the real story. Hundreds of agencies closed, merged, or were acquired. The industry lost 10% of active providers between 2019 and 2022, not through dramatic failures, but through quiet elimination. Sarah Kim's Seattle agency exemplifies this pattern. She started 2023 with $180,000 in unbilled claims. By December, that had grown to $340,000. Her agency was profitable on paper, but broke in reality, trapped in the cash flow death spiral that precedes acquisition. I was running a successful agency that couldn't access its own money, Sarah explained. We were literally succeeding ourselves into bankruptcy. The agencies that survive understand they're not just running healthcare businesses, they are fighting a war for independence against billion-dollar consolidation machines. The successful agencies implement 3 survival strategies. First, obsessive financial monitoring with daily unbilled claims tracking and cash reserves for 60+ days of operations. Second, premium staff retention through professional training, same-day pay options, and benefits packages that compete with retail alternatives. Third, they treat compliance as a competitive advantage with electronic systems that prevent violations before surveys occur. But the window for implementing these strategies is closing rapidly. Every month, more independent agencies disappear into corporate portfolios. The market is consolidating faster than small agencies can adapt. The agencies that hesitate are facing extinction. In healthcare, patient trust and referral relationships take years to build, but can disappear overnight when families lose confidence in your ability to provide consistent care. Watch this next video where I reveal the 3 compliance systems that prevent Medicare termination and the early warning signs that your agency is being targeted for elimination.